Thank you, Madam Chair. And again, thank you, Mr. Secretary, for being here. As I said earlier, I've really had the opportunity in the House and now in the Senate
Yes.
to be on the VA committee for quite a while. We do have a situation where we have a decrease in veterans' health care. So I guess the question is, and I've got all the figures, and we don't need to go through that. You know those, you and your staff know those better than anybody. But the question is, how much risk are we taking, assuming with this budget, and what opinions, how much risk we're taking, and then what options we have if those assumptions aren't correct?
Yeah.
What do we do?
Yeah. Well, I think the highest variability item in this multivariate equation here is community care. And I think it's generous to call it variable because it's variable in one direction, and that's up. And there's a lot of reasons for that, and frankly, we don't know them all yet, and we're looking at that. So, if there is elevated risk, it would be in there. But our options to manage that are our ability to come back to you to ask for some authority to transfer among different accounts in the medical care account, so that we're not taking substantial risk on the provision of care there. At some point, we will take risk on maintenance of the personnel that we need at VA to carry out the full suite of care that veterans expect. Because you can't have a high variability purchase care program that's increasing every year and maintain a high cost direct care system with big fixed costs for personnel. That's the trade-off that we're going to confront at some point. I think we begin to confront it in this budget, which is why we, I think prudently, especially informed by last year's very productive hiring year, make some decisions to downsize VHA and VBA, by the way, as I've promised you we would do, by the end of 25. But frankly, when you consider those numbers, 10,000 over a denominator of about 400,000 employees, that's not much greater than traditional attrition at VHA. Now, we're a little under traditional attrition right now. Why? Well, because you were so generous to us with funding for staffing increases, pay increases, and things like the critical skills incentive. So this might be a little bit harder, might be slightly more risk because retention is up, quit rates are down, but I consider that a high-class problem, not a risky problem.
Right. One thing I'd like to get on the table, just being out and about, visiting in various facilities,
Yes.
again, just talking to providers. As more PACT Act claims are processed, many veterans will see an increase in their disability rating. So you can have people at 70%
Go to
because
100.
of the PACT Act go to 100%.
Yeah.
And then the problem then is, as a result, a number of them will become newly eligible for things like dental benefits.
Yes.
Dental in particular.
Yeah.
Which I hadn't heard a lot about. And I guess the question is, this is rising. The number of veterans eligible prior to the PACT Act grew by more than 8% a year. Last year it grew by nearly 12%. Given that VA dental clinics operate at near capacity, this growth will likely be addressed by community care.
Yeah.
So I want to put that on the table and see if you have a response. But
Yep.
There's just I think a number of things, and this is probably the biggest one of not unintended consequences, but consequences that are out there that we need to take care of. It's a good thing for veterans, but that's going to cost some money.
Yeah, I think you're right that this is a consequence of PACT. I think, frankly, it's among the things that veterans are most excited about because of PACT, because there's so much, you know this better than I do, so much demand for dental.
Right.
And so many people who wish they qualified. So just to give you some numbers, 17% more 100% service-connected veterans today than before the PACT Act was signed.
Right.
It's a substantial number.
Right.
If you consider FY23, we had 690,000 eligible veterans for dental. 567,000 got that care 100% on site. 123,000 got that in the community, right? Our dental staff increase in 23 was about 4.8%. So they saw a similar bump. So we should be able to continue to grow with dental this year. But the big number out there, the big bogey here is 2.78 million eligible veterans for dental by 2028, up from 690,000 in 23. So our budget gets us going on that process.
Good.
But you're right that there's this transition period.
Right.
Until we have dentists, hygienists, and chairs in our facilities, there is this transition period where we're going to be relying on the community.
Right. Great opportunity for veterans. The only thing that would be bad is if we couldn't, once we've said
Can't let them
benefit
down.
is there.
Can't let them down.
Exactly.
Yeah.
Thank you, Madam Chair.
Thank you. Senator Tester.
Yeah, thank you, Madam Chair and Ranking Member. Appreciate you having this hearing, and it's always good to see